Okay. Welcome, Dr. Otto Kernberg. It is good to see you again. Thank you very much for accepting my institute's invitation to do this interview with us. My institute, the Institute of Personality Studies and Development, IPSD, is an institution dedicated to treat patients with personality disorders, to organize and run training programs for treatment for personality disorders, as well as to conduct research on personality disorders. As the director of the institution, I am so happy to be the moderator of the interview today. Before we start the interview, I would like to first introduce Dr. Kernberg. Dr. Otto Kernberg was born in Vienna, Austria in 1928 and moved to Chile when he was at the age of 10. Later, in 1959, he went to United States and now he lives in New York. He is a psychiatrist and a psychoanalyst. He was director of the Personality Disorders Institute at the New York Presbyterian Hospital, Westchester's division, and a full professor of psychiatry at the Weill Cornell Medical College of Cornell University. He retired from the faculty only in May this year at the age of 93. Nowadays, he focuses his works more on writing papers and books and teaching and supervising his students. He is a past president of the International Psychoanalytic Association. He wrote more than 50 books and published more than 300 journals articles. His latest book, Hatred, Emptiness, and Hope, has just come out recently this year. With no doubt, Dr. Kernberg is one of the most influential thinkers, authors, and researchers in the field of personality disorders, their development and etiology, diagnosis, and treatment. His conceptualization of borderline personality disorder and narcissistic pathology is widely recognized and used among professionals today, and his concept of personality organization has significantly influenced the diagnostic paradigm of personality disorders in both DSM-5 and ICD-11. Based on his theories, he also developed a psychoanalytic psychotherapy specifically for severe personality disorders called transference focused psychotherapy, TFP, that has been empirically validated and represents the most psychoanalytic among the borderline treatments. For his contributions, he has received numerous awards in his career, including the Sigourney Award for Psychoanalysis in 1990 and the Great Gold Order of Merit in 2018. He is not only an outstanding clinician and researcher, but also a passionate educator. I first met Dr. Kernberg in person in 2017 when I invited him to Hangzhou to conduct a training workshop for TFP. His coming to China not only has brought TFP into this country and has changed the status of treatment for personality disorders in the country, but also changed my career development and my own life. He is a powerful person, and at the same time, he is amiable. As his students, we often call him Grandpa Kernberg in private, not only because of his age, but more importantly because of his wisdom and the warmth he passed on to us. Otto, I am very happy that you are here with us today, and I believe the interview with you will bring a lot to the audience. And now, I want to introduce our interviewer, Angela, to you. Angela received her Bachelor of Science in Applied Psychology and her Master of Education in Educational Administration. She originally practiced teaching and counseling in a school psychological center. Later, she learned psychodynamic psychotherapy and now working in private practice. She has been practicing in this professional field for 14 years until now. She started learning TFP by herself since 2015 and become very interested in working with different patients with TFP principles. She was a student in the first cohort TFP training program in 2018 in China and had been supervised by Dr. Kernberg. She is also a leader for mindfulness group, teaching 8-week mindfulness class such as mindfulness-based cognitive therapy, MBCT, and mindfulness self-compassion, MSC. Nowadays, she is committed to integrating the wisdom and compassion of counseling and therapy and disseminating it to more people. Otto, I think you would remember Angela. She and I both had been your supervisees in your supervision group from 2019 to 2020. So now I will hand over to Angela and let her play her role. Angela, please, you can start now.
Dear Dr. Otto Kernberg, it's my great honor to interview you. Yeah. So now I will say something for some professionals in China, especially psychotherapists, counselor, and psychiatrists. So we know that you have developed and invented TFP. And I want to learn more about what made you decided to develop TFP, or why do you decided to make TFP as your career, your lifetime work?
First of all, I want to thank Wen Tao. I would like to thank Dr. Koch for a very nice introduction. And I want to thank you, Angela, for your kind words. I became interested in the study of personality disorders early in my career, particularly during 12 years in which I was at the Menninger Foundation in Topeka, Kansas, in the United States, working both as an analyst and training analyst and as a medical doctor in the hospital. I saw many patients with very severe personality disorders. And I participated in a research that was directed by Dr. Robert Wallerstein, who was comparing the effects of psychoanalysis and psychoanalytic psychotherapy, both expressive psychotherapy and supportive psychotherapy, with these personality disorders. In the course of that research that lasted for about 12 years, I became the director of the project and was able to begin the study of the best psychotherapeutic approach for those patients. I had been trained in psychoanalysis and had been trained in the American-based psychoanalytic psychotherapy that combined supportive and analytic elements. And the study of that patient population demonstrated that patients with personality disorders that was not so severe improved with all kinds of treatments, with every treatment, but they improved most with psychoanalysis. But the patients with severe personality disorders did not improve with psychoanalysis, and they did not improve with supportive psychotherapy, but they improved with a psychoanalytic psychotherapy in which enough structures was provided by the hospital to permit to do analytic work in the sessions while there was a clear protective atmosphere and control by their life in the hospital. Those patients who got psychoanalytic expressive psychotherapy under such conditions did the best. And I raised the question in my mind, what can we do to develop a treatment for these severe patients without them having to stay in a hospital for many months? And so I developed empirical research. I tried out alternative approaches with these patients while they were in the hospital, and then once they left the hospital. And I saw patients who had never been hospitalized, but who had very severe personality disorders. So I gradually was able to develop a particular technique based in psychoanalysis, but geared to treat this severe personality disorder by changing some of the techniques in psychoanalysis and providing a firm structure on an outpatient basis so that it could be done without the hospital in ordinary outpatient sessions. And I was able to do that with 2 or 3 sessions per week, rather than 4 sessions of psychoanalysis or 5 sessions of psychoanalysis. I developed this method very gradually. And after I left the Menninger Foundation and became the director of the borderline personality disorders service of the New York State Psychiatric Institute of Columbia University, I used that unit to further develop the technique. And finally, when I became medical director at the Westchester division of the New York Hospital, I decided to start a formal empirical research, first better definitions of the personality in order to study moderators derived from the personality of the patients. Second, to study the nature of the psychopathology that was not clear within psychoanalytic theory and technique. There was no clear differentiation of various types of severity of personality disorders. So with a group of co-workers, we studied the personality, defined the various personality types, severity of illness, and simultaneously developed an integrated, comprehensive outline of the specific technique that I had developed. And we studied the effect of that technique compared with dialectic behavior therapy, compared with supportive psychotherapy, with ordinary hospital management. And we came to the conclusion that this technique that I called transference-focused psychotherapy indeed improves patients with severe personality disorder, permits to bring about fundamental personality changes, and is much more effective either than supportive psychotherapy or psychoanalysis. So these were the steps, and I was accompanied in it by John Clarkin, who was an excellent empirical researcher and carried out the research design, and by a group of clinicians who were able who were psychoanalysts and psychoanalytic psychotherapists interested in research and willing to work together, and with one project after another. And we have been working together for 35 years. It has been a very stable group, and we were able to define better the severe personality disorders, borderline personality organization, narcissistic personality disorders, and special syndromes, discuss treatments of the complications, and publish our findings, which have been replicated in studies done in Europe under the direction of Stefan Döring, with groups in Vienna and Munich and Berlin. And we are still involved in new empirical research now, including groups in Spain and Italy. And of course, we have now systematized the teaching so we can train psychotherapists in a homogeneous way throughout the various countries of the world. That is the history of the treatment. I don't know whether you wanted me to now to describe the essence of the treatment, but this is in response to your question, how did I get there?
Yeah.
I will give you a little practical example of the many things that I observed and that we have now all integrated. I had one patient, a borderline patient, who developed intense rage attacks in the session with me. She became furious. She attacked me. She thought I was dominant, I was sadistic, I was incompetent. And she went into a blank rage. At the end of the session with her, I was totally exhausted. She left the office, and my office had the window where I was sitting on the corridor in front of the hospital where patients would leave. So the patient left my office enraged, and I could continue seeing her walking on that corridor. And she met a friend of hers and said, "Hello, how are you?" and was perfectly happy, completely relaxed. That was a minute, less than a minute after she left my office. I couldn't believe it. I was all upset. She was totally, and so the two women talked with each other. It was the most impressive manifestation of the mechanism of splitting. And I had it there concretely. So I'm giving this just as an illustration how the observation of these patients during the hospital over a month permitted to clarify their defensive mechanisms and how it fit with the personality and how to deal with it.
Yeah. It was a long story, and thank you for introducing this history to all of us, which I know that you really have a great heart for those people who are in severe personality disorder problems.